Thanks for joining us, listeners. Today's program features our guest from Vitality Integrated Program Services, the VIPs, Vitality Unlimited in our community. Marianne McKown joins us, and she's the Outreach Partnership Coordinator for Vitality. Marianne, Happy New Year.
Oh, thank you, Lori. Happy New Year to you as well.
Absolutely. I think we can say that for a while when you haven't seen someone and it is the new year. And this is a great time to catch up. I mean, there are a lot of things going on in the world, close to home. We just got through holidays. And we know that 2026 might bring some exciting new things to Vitality. I mean, things that are in the works. But we really want to focus today on the things that Vitality has been doing so well now since 1971.
Yes, absolutely. So for a lot of people, they know about Vitality. They know us as Vitality Center. We are Vitality Unlimited. We've been in this community since 1971. We were founded here, which is, sometimes I think people find it unusual that our headquarters is in Elko, even though we have clinics in Reno and Carson City and Dayton. Our heart still lives right here in Elko County.
Well, when you think about it, it does make sense because we are isolated geographically. A lot of folks move here. There may be several generations of families, but the people that move here can be isolated from the type of support that they need most. And I know Dorothy North, of course, the late Dorothy, she was committed and dedicated to understanding and creating awareness and propping up people who certainly deserved second, if not third chances. And then today, Esther Quillisi continues that as the CEO of Vitality, and she and Dorothy worked so closely together, and with Esther's leadership, this legacy continues, and as you said, Marianne, it has expanded and grown, and for good reason.
Oh, absolutely. A lot of people don't know that Vitality Unlimited started in 1971, and we were a one-person operation when it started, and the whole reason was to provide substance use disorder treatment. And it was outpatient at that time, and it grew, and we built Vitality Center, which if you've lived here in this community, a lot of people do know about Vitality Center. That's our residential substance use disorder treatment facility. It also has co-occurring mental health services. About 80 to 92% of the clients who come through our doors, they aren't just having to deal with a substance use issue, which is a mental health issue all on its own. They are also having to deal with other mental health conditions. A lot of people come in, they have anxiety, they have depression, PTSD. We've had people come in that schizophrenics that have schizophrenia. So there's so many components to somebody's health and making somebody healthier. And I think, we said Happy New Year, and what does everybody think of right away is, I got to get back to the gym. I've got to start taking care of myself better. Well, don't forget that you also have your mental health. Your behavioral health is the more current term. Is looking at your whole body. It's not just your physical health. If you aren't addressing the stress in your life, you could have stress, you could have grief, you could, you've lost a job, you just gained a job. I mean, there's also good stress that, there could be a lot of good things that are happening, but it's coming at you really fast. You might want to talk to somebody about that and relieve some of that off of yourself. And that's where Vitality can step in and help.
That's right. We're talking with Marianne McKown today, and of course the evolution of Vitality Unlimited, as she was describing, from a lone addiction substance abuse treatment center here in Elko to growing now into these mental health treatments and providing services to people from all over northern Nevada, essentially. And in fact, Vitality was the one to pilot the program of the certified behavioral health centers, right?
Yes. So in 2017, we were one of the very first, they were called demonstration projects in the country. And there were 4 that started, and we were there was, I think, one of 3 that survived through and still exists today. And they've grown. So they're certified community behavioral health clinics. And basically we can provide mental health therapy, targeted case management, peer recovery support specialists, substance use treatment. That's all outpatient, but also primary care. A lot of people don't realize that we have an in-person APRN who he can provide primary care to people. So that way we are addressing the person as a whole. That's always our goal, is to address everybody's health as a whole. If you come in for a therapy appointment, we still take your vitals. We still want to make sure, is your heartbeat okay? Are you doing well physically? Because you never know, you may not realize that something else is going on. So, and it's pretty wonderful. We've been able to really add to our staff, and the fact that we have in-person primary care. Again, we have 2 therapists that are in person. And our targeted case manager, wonderful. So is our peer recovery support specialist. And people may not know what those terms are. When you come in for therapy, you want to be able to sit there and actually do that work on whatever your mental health condition is. But you might also be stressing out that I need to apply for a job, or I'm having issues navigating through Social Security or different agencies. That's where our targeted case managers can come in, and they can assist with those sort of services. They also can assist with basic skills. They can lead support groups, which hopefully we will be having groups start up again soon. And then we have our peer recovery support specialist. Usually that is for people who are dealing with substance use disorder treatment. And what the peer does is, one, they're state certified. So it's not just anybody that comes in off the street. They are somebody with lived experience having to deal with either substance use or mental health, sometimes both. And they also, if it's substance use, they have to be clean and sober for 2 years before they can become certified by the state. They are supervised by a mental health professional and a peer supervisor. But it's that extra cheering section for somebody, because it can be very difficult trying to maintain your sobriety. And to have somebody there in your corner that understands where you're coming from, because you might be talking to your therapist and thinking, well, you don't know what it's like. You don't know what it's like to have a pull to use something, either opioids, alcohol, whatever that happens to be. But having that peer, they do. They understand where you're coming from, and they are the example that, hey, I got my life put together. I have a job. I'm dealing with it. I'm staying clean and sober. So can you. So it's a really great cheerleader.
Exactly. And they're still living and working, as you said, and contributing even with an addiction, because that is something that is lifelong. It's like any illness that has to be managed, Marianne. Mm-hmm. And so, that does sound really encouraging, because the common complaint we do hear from folks is that, well, I didn't really connect with my therapist, or telehealth didn't work for me. It was good for a couple of visits. But now with Vitality's programs, as you said, you have 2 in-person therapists. You get the wraparound service. So when you go in, someone's going to check your blood pressure, because if something's off with you physically, that is definitely going to affect your mental well-being.
Oh yeah, well, and we've had that. We've had somebody come in. They came in for a regular appointment, and their blood pressure was way higher than normal. So then we immediately call in our APRN. Hey, can you please take a look at this person? And if it might get escalated, and then we call an ambulance.
That's right. Or it could be a medical issue, or it could be related to medication.
It could be related to medication, or it just could be that they're having that they're a panic attack. There's something, but we always try to make sure that we treat the whole person at Vitality.
Of course, we're talking with Marianne McKown. She is the outreach specialist with Vitality Unlimited, outreach and partnership in creating those important collaborations and moving forward in the new year with Vitality, providing complete behavioral health and, again, wraparound services with an in-person healthcare provider that is attached directly to the practice. And then also this idea, too, which I think it was very successful in 2025, Marianne, of having a practice without walls. walls, as Esther likes to describe. I know she's really proud of that, having being a native of Elko County, rural Nevada, understands about these wide open spaces and the significance of bringing services to people.
Oh, absolutely. We still have our mobile therapy van. We've taken it to Fish. We take it out to the humanitarian camp. If somebody is homebound and they really want to talk to a therapist, we can go to them. Our targeted case managers and our peer recovery support specialists make home visit all the time. So they will go to the person's home. You don't necessarily have to worry about getting yourself to our clinic. And we all know, I mean, what taxi service do we have? We don't have a lot of people around here who have Uber or Lyft. I think there might be one. So if your car breaks down, if you're having just difficulty, or we've had people that they just stress so much about even going to their appointment, it creates an anxiety. So then I had a person call and ask me, they're like, well, I just get so anxious about even making it to my car to get in, and I really need to talk to somebody. I said, have you ever asked for our van? We can come to you. We can set it up in the appointment so that we can come to your door. And the person had no idea. So that's some of the things that we can assist people on.
So someone listening might say, this all sounds amazing, but it sounds expensive, right, Marianne? So we want to make sure we talk about that and the access to mental health care, and then also to substance abuse treatment.
Well, so mental health care, any behavioral health, most insurances pay for to go see a therapist, to go see a substance use treatment facility. You also, Medicaid covers it. There's so many different ways. We take Medicaid, we take Medicare. I have a lot of people like, oh, you take Medicare. Yes, we take Medicare, which is also why we try to strive and let people know that we have the primary care. So let's say you're like, I don't really need a therapist. I don't have an issue with substances, but I really need a primary care doctor. Well, you can come to us just for that. You don't have to come to us for therapy and substance use to get access to our APRN that can provide primary care.
Well, that's important, and that is available here in Elko by calling 775-777-8477, correct?
Yep, that is correct.
All right. And then, of course, with the Vitalities, the enduring programs since 1971, helping, in some cases, generations of families break these cycles.
Oh, yeah.
You're working collaboratively with different agencies, right, Marianne? We know that, I think you mentioned Fish, going to Friends in Service Helping. There are homeless people, but there are also people just in need in the community. You've even made trips up to the Elko Senior Center because there are special needs there.
Yes, we've gone up to the Senior Center, Fish, just pretty much any. I'm going out to Wells. I think it's next week for their health fair to let people know that, because if let's say we had a bunch of people in Wells that needed us to come to them, we could set up those appointments so that we can get those services done. And let's say you don't want anybody at your house. You can also access our therapists through telehealth as well. We have plenty of people. We have people in West Wendover, in Jackpot, who they can't make it to us. You don't necessarily have to have the appointment in person. You can have it through Zoom. Zoom actually has specific HIPAA compliant Zooms. I don't know. I'm not a technical person, so.
Yeah. Sometimes just in your regular meeting, you might think, well, what have we just been Zoomed by some outside source? So I guess I can see that. Yeah.
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 So it's one of those things that telehealth is very readily available, but I also know there's quite a few people that they do not want to do telehealth. They don't want to have that interaction with a therapist. They don't want that screen between them. So we have, like I said, 2 in-person therapists, and we can see as young as 8 years old.
Oh, that was another important question, right? As young as 8.
Yes.
Marianne, okay.
Yeah.
So these are opportunities available, and I know something we talked about that we wanted to talk about during this half hour is that not everybody is aware, and it could simply be because they haven't needed the services.
That's what I'm guessing. I try to stay really well informed on the different services that are available. It might just be that I had a previous journalism background. But I'm also involved in the Elko Opioid Response Task Force. So Elko, for those people out there, Elko County is basically had a survey done to figure out where we stand with the opioid crisis that has happened in this country. And they sent out a survey for people to take. And what surprised me is that when they asked, have you heard about these opioid-related initiatives or services in Elko County, not even 45% said that they had heard of mental health care in Elko County. And then when I saw that, you would go down to community-based recovery support services, it was about 32 to 33%. That's like AA, NA, those kind of things. Only 32 to 33% have heard of those. And then I saw treatment for substance use disorder by a local provider, and it was slightly over 25% had heard of them. And I'm like, we've been here since 1971. How have you not heard about Vitality Unlimited and what we provide to this community? But all I could think is, if it doesn't directly affect you and your family, it's not on your radar. Mm-hmm. You're not thinking about it. I don't know.
I have to agree. I mean, and it's nice to think that overall we have a healthy community, but there are also those times, and if it's not for you, it's for a loved one, someone you care for.
Yes. Well, and for a loved one, somebody you care for, somebody you work with. Mm-hmm. There are so many ways that, mental health, substance use disorder, it can affect anybody, anywhere. This survey also showed that a lot of people attributed opioid use to homelessness, and that's not necessarily true. It's an impression, but that's not necessarily true statistically. And I've brought it up too a lot of times that I think the opioid crisis in this country is extremely important, and we need to deal with it, and we need to deal with that issue. But the number one substance people have an issue with is alcohol.
Yeah.
That's the substance that we treat the most often anywhere in this country, including at Vitality.
And in fact, if you look at it that way, if you have a dependency in alcohol or of alcohol, and that's in your family, that could lead to use of these harder drugs. And so maybe that idea that homelessness, those, folks that are homeless are opioid abusers, well, maybe it led to being homeless. I mean, that's the reality, right?
It's very possible. It's very, very possible.
So now's the time to evaluate what's going on in your own life or your family so that you can get help before that cascade.
Oh,
right?
Definitely. And that's the thing. If you're not, and I go back to that mental health condition, if you aren't dealing with your mental health, if you're not being honest with yourself about how your mental health is, you may start to self-medicate. And that self-medication can lead to something else, can lead to a substance use disorder.
And it can shave off years of your life, of which obviously the people around you would just miss you so much. And that's the other thing that we're trying to emphasize too, is especially with mental health services that we want to create and generate that awareness and care, that we care about people in our community and we don't want them to die by suicide.
Yeah, no, we don't want them to, and we don't want them to harm themselves in any way.
Yes. And
that's a thing that one of the things that Vitality can assist with. Like I said, we have the in-person APRN, and he can do primary care and psychiatric. So we also can prescribe medication-assisted therapy. So basically, there are several different drugs medications that can assist people in getting off of, the illegal substances or the substances that are doing them more harm.
Mm-hmm. So it can be a stabilizing force. It doesn't have to be permanent, but for someone who's just bouncing off, literally things are spiraling, Marianne, it's important to get in and at least consult with professionals.
Absolutely. And I also believe that it's not just about taking a pill. It's not just medication. having that talk therapy, having that substance use counselor that has years of being able to tell people this is how a better way to cope, informing you on better coping mechanisms. It kind of reminds me of, if I don't know what to do at the gym and I walk into the gym, they have trainers there that I can say, hey, how do I use this machine? What is the best way for me to build muscle? What is the best, what are you looking to do? Are you, do you want to build muscle, get leaner? What are all those things? Would I just go in? I mean, yeah, I guess I could Google it, but Google's not going to tell you if you have the right form, if you're doing something that might hurt you. That's the same thing with your mental health. You may be able to put into Google whatever you want to ask that AI, but having a person that actually has experience and dealing with different situations, they can help build how to better cope with different stressors.
Again, helping to break the cycle, helping to reassure someone, and then helping a family too, because Vitality Unlimited, the integrated programs, always involve families as much as the individual wants the family to be involved. But this can be an entire process, a step-by-step process to seeking overall health. And as you mentioned, grief. I mean, there are grief support groups and other kinds of support groups that can also involve people who are having similar experiences in the community.
Oh, yeah, absolutely. And we've had several people, well, I've had, when I go to health fairs and things, people ask me, well, do you have anybody that can help with grief? And I said, any of our licensed clinical social workers can help with that. Any mental health therapist can assist with grief. The other thing too is I've had people ask me, well, I have this family member or that friend that, is struggling with a substance use issue. And after I start talking with them, I go, you could probably use our services as well. You might want somebody to be able to talk to and relieve the stress of having to deal with a family member who has an issue that they're not handling the way you think they need to be handling it. And that was one of the things that actually was brought up during this survey as well. One of the participants, he basically asked, he said, well, what are the suggestions for people who are burnt out on helping a family member or a friend with a substance use disorder? Well, one of the options that might work is come see us, come talk to a therapist. If you are at your wit's end and you don't know how to convince them to get help, maybe talk to one of our therapists or substance use counselors and they can give you some guidance. There's so many different tricks to the trade that is very helpful to, ask for help when you need it.
Ask for help. That's really that's key to everything. And I think, Marianne, that's been a good sort of sidebar is if you are caring for someone and they are, it does create stress in your life, you do need to be able to talk to someone, and you might be surprised what you learn about yourself. And there is such a thing as codependency. And so, you could help your own situation.
And it brings me back to a lot of people ask me, well, I don't have a mental illness, so I don't need any of that. I said, are you alive and breathing? If you are alive and breathing, you probably have some mental health stressors, mental health issues. They may not be permanent. They may be a temporary situation, but it is definitely a mental health condition that a therapist can assist you with and maybe let you get through it faster, quicker, and easier than trying to go through it on your own. And I still think in our community and in the country, but in this community, there's still very much that stigma. Just because you're going through a mental health condition, whether that is depression, grief, anxiety, substance use disorder, those are all mental health conditions. You may need help. Don't be afraid to ask for it. I get that it can be very scary, but if you had a broken bone, you wouldn't set it yourself. You'd go see a doctor. So you should treat your mental health and any of your substance use disorder issues the same way.
We're talking with Marianne McKown. She is helping, of course, her position is in outreach and collaboration and creating these important partnerships in the community, generating awareness, helping people make connections with mental health and abuse, substance abuse treatment, addiction issues in our community through the Vitality Unlimited integrated programs, the CCBHC. That's the it's certified complete behavioral health services. That means if you walk in the door and you're not feeling well, you're going to be greeted with, as you said, a nurse professional, and they can treat those symptoms as well. And then you can also meet with an in-person therapist who can help you sort through what some of the issues might be. Again, with a goal, to stabilize, to help you break the cycle, to help you live healthier.
Oh, yeah, absolutely. And, again, I just love that we have all of the in-person staff, that we have in-person therapy, in-person substance use treatment. That's in our outpatient and in our residential unit. And anybody who needs to call, that number, 775-777-8477, Monday through Saturday. We have therapy hours on Saturday as well as the rest of the week. And just don't be afraid to call.
And do know that, again, we sort of hinted that Vitality always has something going. There's always something new to look forward to. We'll talk more about that as the new year progresses. But something that you were able to realize last year was the new women's facility, right? Or was that 2 years ago?
It was a couple of years ago.
Now, already. Yeah.
So, and that was a wonderful addition. So basically in Vitality Center, we have 22 beds that are for the men in residential, 6 that are for what people used to refer to as detox, but it's withdrawal management is the correct term. But we have 10 beds in the women's house. And basically what that is, Vitality Center is co-ed. You have men and women. We can have clients as young as 14 in Vitality Center. Fortunately, we don't get very many teenagers. I'm hoping that's because they are getting outpatient treatment, because residential care is a higher level of care than outpatient. So, but the women's house was a wonderful addition that the city assisted us in getting built through ARPA funds. And it was wonderful, one, because it was nice to have them in a new facility. The women get to sleep at the women's house, and then they get all of their courses and things at Vitality Center itself. But also Vitality Center was upgraded. So, because that building was built in the 80s. So it needed a little bit of a facelift. We got new windows, which of course made it more energy efficient. Just got a little bit of a remodel inside, makes it look a little bit more welcoming and homey. It's wonderful. Just an absolute wonderful addition.
Those environments can be so important. And just like an environment, your partners in the community. And I wondered about how things might be going from your perspective with the behavioral health unit at the hospital in NRH, third floor.
We have a wonderful relationship with the hospital. We meet with them once a month to make sure that communication is going well between them and us, because with their third floor, they have a focus that people go into there with a mental health issue is the primary reason. Now, when they come into Vitality Center, the primary reason is a substance use disorder. There may be mental health as well, but the primary reason is a substance use disorder. So it's a pretty good partnership. Mm-hmm. But yeah, we've been working with the hospital for quite some time. Yeah, we try to work with anybody in the community to help make this community healthier.
Marianne, thank you so much. I just checking over my shoulder in the time, but anything that we didn't get to today that you were hoping that we would mention? We appreciate you being here.
I would just say, again, if you or a family member are struggling with your mental health or struggling just with stress in your life, and you feel like you really need to talk to somebody to get something off your chest, don't be afraid to call us. If you are in crisis, you can call us. We drop everything for a crisis call. You don't have to fill out paper. If you're in crisis, we're not going to make you fill out paperwork before you get to talk to a therapist. We will get you to a therapist right away. We do have bilingual services. So whether it's English or Spanish, we can get you in. If it's something other than those two, I think we even have a translation service that can assist. But if you need our assistance, please call 775-777-8477. And you can also visit our website, vitalityunlimited.org.
Marianne, thank you so much. We'll look forward to more conversations in this new year. We appreciate your time today.
Oh, well, thank you for having me on the show, Lori.
And thank you, listeners, for joining us for today's Elko Live, again featuring Vitality Integrated Program Services.